Just wondered, Jeremy, I mean, I appreciate what you've just said there, but what you didn't mention was sort of the bureaucracy in the NHS. And I mean, when in 1948, the first year of the NHS, it cost £11.4 billion in today's prices. The 2018-19 budget was £153 billion. It's gone up faster than the GDP in the country's gone up. It's gone up faster than public expenditure as a whole. That's clearly not sustainable. Since 2009, and like I say, you were there for a lot of this period, the number of very senior managers in the NHS has gone up from 944 in 2010 to 2,700 last year. So, I mean, is this not the problem, that the government over the last 12 years has just sort of not tackled the massive bureaucracy, and that's where all the money's going into?
Well, I think they're two different issues. I totally agree with you. The biggest issue in the NHS today is the bureaucracy. There's 1.4 million people in the NHS. It's the fifth biggest employer in the world, biggest in Europe. Bill Clinton had a great saying. He said, politics is like working in a graveyard. There are lots of people underneath you, but they're not necessarily listening. And it does feel like that when you're health secretary on top of this huge pyramid. And that's why I say in this book, we should scrap the targets. We have more targets in the health service than in any other country in the world. And targets create bureaucracy because you end up having to employ people to check up on everyone. And the result is in our system that doctors, people running hospitals, nurses, they're always looking over their shoulder to their line manager to see if they're hitting the target they've been given. And they can't spend so much attention on the patient in front of them. So absolutely scrap national targets, free up doctors, nurses, midwives to focus on the patient in front of them. On the sustainability question, that is the $6 million question that is faced actually in every country in the world. I mean, the truth is we're going to pay more for our health and care. In America, you're going to pay more through your insurance premiums. In France and in Germany and Holland, you're going to pay more through your social insurance premiums. In Britain and Ireland, you're going to pay more through your taxes. And I think that is just the reality. We're living for much longer. And there are new medicines coming on stream. And so we've just got to be honest with people and make sure if it's taxpayers who are paying, that we root out the inefficiency and the bureaucracy so that people feel they're getting value for money.